Let's start this discussion with a metaphor. Very few of us know how to take apart or put together what's under the hood of our cars. We just want them to work. By the same logic, very few of us understand the internal organization that is Ontario's $50 billion a year healthcare system. But we do want to know that when we're sick, the personnel and resources will be there to help us. To that end, the provincial government has just passed something it calls the Patients First Act. And joining us now to explain what it's all about is the Minister of Health and Long-Term Care, the MPP for St. Paul's. Here's Dr. Eric Hoskins. Welcome back to TVO.
It's good to see you again.
Nice to see you as well. Here's what you guys put out on your website as what this new law is all about. Ontario passed legislation that will help patients and their families obtain better access to a more local and integrated healthcare system, improving the patient experience and delivering higher quality care. The Patients First Act will help ensure patients are at the center of the healthcare system. So let's start there. What, in your view, has prevented patients in the past from being at the center of the healthcare system?
Well, I don't think it's any one thing. Part of the challenge is that patients, their caregivers, their loved ones haven't been part of the decision-making process. So we wanted to address that issue in the Patients First Act. Part of it is that the decisions which historically have been made in Toronto, when we push those decisions closer to the communities that are impacted through our LHINs, through our local health integration networks, we found, and we got actually very good advice, particularly from primary care providers, that we could do a even better job at local decision making, involving local individuals with the experience and the knowledge of the needs and the resources available in the community if we actually went even further, deeper into communities to provide that expertise and provide that service.
Let's follow up on that, because these LHINs have even more power now, local health integration networks, and I'm not sure people know what they actually do. So let's start there. What does a LHIN do?
Well, they're kind of like regional health authorities. So we have so we've divided the province up into 14 different regions. Each one has a LHIN, a local health integration network, and as the name implies, their job is to ensure that the services are provided to the local communities, and also that they're to integrate and coordinate the services. And again, getting back to Patients First Act, a big part of the rationale behind the Act was to further coordinate and integrate the services. So then, rather than having a number of siloed services, so primary care working over here, public health working on its own over here, home and community care a silo among itself, we're trying to bring them all together with local decision makers through the LHINs so we can provide that health service in a more seamless way. Getting back to the patient and the Ontarian, they're less concerned about who's providing the care and more that they want to have as seamless an experience as possible in the delivery of high quality of care that's going to provide good outcomes.
The ministry press release again says that your act will strengthen the voices of patients and families in their own healthcare planning. How so?
Well, we're doing a couple of things. So we've legislated the requirement that our local health integration networks have to have, each of them, a patient family advisory council. So we want patients and their families and their caregivers and loved ones, those that can really truly provide that perspective, to actually be part of the decision-making process, where the LHINs have to actually consult with them and receive and act upon their advice. I also am in the process of appointing, I've announced this already, I'm appointing my own Patient Family Advisory Council for the first time in the history of the province. And this will be a council of patients and families, caregivers, that will consult with and report directly to me in terms of how we can make our healthcare system even more patient-focused.
Ministry says it's consulted with 6,000 individuals and organizations before making the changes in this act. Can you tell me any provincial healthcare organization of significance that supports what you're doing?
Well, I can certainly tell you that the vast majority of the associations that represent our frontline healthcare workers support this.
Well, not doctors and nurses, so who else?
Well, I wouldn't say the nurses don't. Many nurses organizations have come forward in support. Many organizations that work in home care support our efforts to dissolve the community care access centers and bring the resources, the home and community care resources, into the LHINs. We estimate by doing that, we're going to be saving 5 to 8% on administrative costs and senior management positions that will no longer be required.
You really think that'll happen?
Yeah, and we'll be reinvesting. That was a priority for me from day one, to find those savings and reinvest them into frontline care. So we consulted widely, including with the Ontario Medical Association. I know that they have suggested otherwise. But
I don't think they say they haven't been consulted, but they certainly don't agree with what you're doing.
well, they've said that they haven't been consulted. And so we based a significant portion of the Patients First Act on a report that was developed by leaders within primary care, many of them doctors and other healthcare professionals as well, nurses and others, in a report that came out a couple of years ago called the Price-Baker Report. As early as June of last year, 2015, we began our consultation process with the OMA to share the findings of that report, which proposed and advocated for a stronger integration of primary care into the rest of the healthcare system, and in fact advocated for the creation of these, what we're calling sub-LHIN regions, where we drive the decision-making closer into the community so we can assess the needs and then respond directly to the needs at the local level. Since then, in December of last year, I released my discussion paper on Patients First, consulted, as you mentioned, with more than 6,000 individuals across the province. The OMA in February of this year, they released their response to that discussion paper following their own consultation. In fact, that report, their response is on their website for everyone to see. So we've certainly consulted widely, and I can appreciate there are some concerns that have been raised. There are some, like the nurses, for example, that feel that we aren't going quickly enough. I think RNAO, for example, the Registered Nurses Association of Ontario, are broadly supportive of what we're attempting to do. However, they want to push the home and community care workers immediately and further and more deeply into the primary care domain. We want to move in that direction as well, but we know that we have to do it in a stepwise approach to make sure that we're not making any mistakes that will impact patient care.
I know it's not always the case that when group after group after group comes before a committee of the legislature to complain or protest or say they don't like what you're doing, that's not always an indication of what the broader population thinks. But having said that, it is also accurate to say that a litany of groups did come forward and did testify before the committee that it thought that this was not a good thing, what you're doing here. And I'll quote from one of them here. This is a woman named Kathy Bugeya, who's a management consultant, who says one of the things, and she testified at the legislature, said, "One thing I've learned throughout all my years as a caregiver, spending hundreds of hours in ERs and in wards and in doctors' offices, on the phone trying to arrange another crumb of care, if you want or need something from someone, the last thing you do is poke your fingers in their eyes. But that's exactly what this government has been doing continuously to our physicians and other healthcare providers in this system for the past 3 years. Stop doing that. You're making my life infinitely harder." What would you say to her?
Well, we're working to make her life better. So, for example, by taking the advice of the Auditor General and making changes to how we deliver home and community care, which is obviously a preoccupation of hers, by mandating a patient and family advisory council in each one of the LHINs so that individuals like her and other caregivers can have a voice at the table in decision making. With regards to the OMA, I've worked extremely hard over the last 2+ years to try to reach an agreement with our physicians. I've done that in good faith. We did reach a tentative agreement, as you're aware, with the leadership of the OMA. It was endorsed by the president of the OMA, our tentative agreement.
Yeah, and the membership rejected it.
But it was supported by the board of the OMA as well. Yeah. So that was the partner that I had at the time.
But this has nothing to do with that.
No, but she's suggesting that she was speaking specifically about the interaction and the relationship between physicians and the government. But in terms of her role as a caretaker, I believe strongly that this will result in changes that will benefit individuals like her. It will result in greater investments, that 5 to 8% savings that we're going to find by bringing the community care access centers into the LHINs, reinvesting that money into frontline care, but also importantly, and perhaps most importantly, is giving individuals a voice like they never had before. And in addition to that as well, we're working towards, I just made an announcement earlier this year of, I think it was in the order of $20 million specifically to go to caregiver supports like respite and other important measures that recognize the critically important role that caregivers have in this province in caring for their loved ones. And we need to do more. We are working to provide better supports for them.
Okay, one of the stakeholders in this system is the Ontario Public Service Employees Union, who do a lot of work in the healthcare system, a lot of the lower paying jobs in the system. And here's what they had to say about this new Patients First Act says putting more power into the hands of the LHINs is a recipe for disaster, said Sarah LaBelle, chair of OPSU's Hospitals Professionals Division. The LHINs are not accountable to the public. They answer to the ministry and do its bidding. She's kind of right about that, isn't she? I mean, the public doesn't elect the members of the LHINs. They are accountable to you, not the public.
And I'm accountable to the public. So the LHINs already have responsibility for our hospitals. They already have responsibility for long-term care. They already have responsibility for community organizations that are funded through the ministry as well that deliver important care.
You concerned they got too much power?
Not at all. They've been around for a decade. I think this is the appropriate time. They are local health integration networks. I think if we want to create that more coordinated care, if we want to move beyond the siloed provision of health care, which results often in that fractured care or the difficulty moving from one aspect of care into another aspect of care. If we want to streamline that process, I think it's important that there be, which I've argued strongly for, a relationship between our LHINs and public health, for example. So our public health experts, who are the experts in health equity and the social determinants of health, in population health, so that the entire healthcare system can benefit from that expertise.
But I got to understand this accountability angle better. I mean, I understand you're the Minister of Health. At the end of the day, the buck stops with you. You're accountable. But if somebody has a problem with their local health integration network,
yes.
I mean, 13 million Ontario citizens can't get to you. I mean, they presumably have to deal with their local health integration network. Where's the accountability there?
Well, if they're unsatisfied with the decision that has been taken with regards to their care, the care of a loved one, there is a process within the LHINs or within the hospital environment, for example, or within community, with home and community care. If they remain dissatisfied, they can go to the patient ombudsman. That is a position that we've created.
We had her on just a few weeks ago.
Right, and so,
Christine Elliott.
And in fact, this legislation gives her oversight of the LHINs as well, and all of the patient-touching aspects of what the LHIN is being asked to do or currently is doing.
I know you know Nadia Allam, the general practitioner, anesthetist from Georgetown. She was part of Concerned Ontario Doctors for a while. She's now more involved with the Ontario Medical Association. Here's what she said. She said, its premise, streamline and integrate healthcare, sounds great in theory, but reading the legislation, it's clear that Bill 41, the Patients First Act, will not solve the real-world issues that real-world Ontarians face. Instead, it will burden a struggling healthcare system with an expensive and unnecessary layer of bureaucracy. Diverting more money to fund six-figure executive director salaries means less money to fund direct patient care by doctors, nurses, physiotherapists, and so on. Why is she wrong?
Well, I disagree with the premise.
I know you do, but why is she wrong?
Well, because we're not creating a new layer of bureaucracy. In fact, we are finding efficiencies. We're reducing positions where those positions overlap. By migrating the activities for home and community care into the LHINs, we're going to find, as I mentioned, 5 to 8% savings that will be reinvested in frontline health care.
Do you guarantee that?
Well, as much as anyone can guarantee anything. Certainly, this has been a priority. There's an expectation by Ontarians when we propose this transformation that those savings be found. And so I've instructed the ministry to ensure that those savings are found and are reinvested into frontline care.
You're a resident of the City of Toronto, and we all remember the megacity debates from 20 years ago when they said, we'll take 6 cities, we'll amalgamate into one, and we'll be able to streamline all that bureaucracy and hold budgets down. It just doesn't seem to happen.
But it's different, right? So we've got 2 different entities. For example, even if you just look at our community care access centers, which are being dissolved, and our LHINs that have so many duplications in terms of even the back-end services that are provided, whether that's IT or administrative or financial. There's no question that savings will be found when those entities are merged and those duplications can be eliminated. But also the idea that there's somehow a new layer of bureaucracy being created is also not accurate. That we're creating, at the level of the community, we're creating what we're calling sub-LHIN regions, which will...
Maybe that's what they're referring to, a new level of bureaucracy.
But they're existing entities. They might be a health links, for example. We have more than 80 health links across the province which are already functioning, which are providing that primary care leadership. What we're doing is we're identifying, and many healthcare providers are coming forward, we're identifying that leadership at the local level. So you might have, for example, instead of within a LHIN, the city of Guelph might have its own sub-LHIN region where we will be working with local health leadership. It's not a layer of bureaucracy. These are individuals that are already there that are going to provide local leadership to identify what resources are available, what the needs of the community are, and how to manage that, and how to actually provide the resources and the services that that community needs. So there is the creation of these sub-LHIN regions in name, but it isn't a level of bureaucracy that is going to take away from the savings that will accrue as a result of bringing these various the CCACs together with the LHINs.
Let me do one more question on that, because Ontario's Auditor General did investigate two of the larger institutions in healthcare, the local health integration networks and the community care access centers, LHINs and CCACs. Your world is filled with acronyms that are very difficult to remember. The Auditor General found far too much money spent on administration and bureaucracy, and on the LHINs, they scored a 6 out of 15 on a range of performance metrics. So again, I wonder why Ontarians should have confidence in a new law that seems to put more power in the hands of an institution that so far has not proved, certainly to the Auditor General's satisfaction, that it can do the job.
Well, we're following many of the recommendations that the Auditor General provided over the course of last year. In fact, the decision to dissolve the LHINs, rather dissolve the CCACs, was largely a result of the good advice that she provided in two separate reports last year. So
why should we have confidence in the new process?
Well, because the process is reducing the duplication that exists by having two separate entities deliver services. The LHIN on the one hand providing that accountability and oversight of the hospitals and long-term care homes and community care, and then the home and community care being dealt with separately. So by bringing that in, it's going to provide for greater coordination. That we've been working with our LHINs over the course of the past year to make sure that they have the resources, that they have the human resources as well, and the talent and expertise to be able to accommodate this effectively. And I'm confident that they'll be able to do that. And that's part of the reason why we're also addressing other issues. Well, we have the patient and family advisory councils. We have the relationship that we're going to be building with public health as well. That we have the primary care aspect of this, which is so important, which was the recommendation coming from the Price-David report, as far as the Price-Baker report from 2 years ago, that the intent of the Patients First Act, I think, at its core, is to look at healthcare a little bit differently. Rather than look at the delivery of services and programs and the providers that deliver that service, we're trying to look at it from the perspective of the patient. How can we build and continue to build a healthcare system that provides the best possible patient experience and as seamless as an experience as possible?
Then let me ask one last question on the role of the patient. There's all sorts of stakeholders in your healthcare system, I don't have to tell you. You've got doctors, you've got nurses, you've got orderlies, you've got people who build hospitals, you've got, I mean, the list is endless. There's one organization out there, to the best of my knowledge, that represents the interests of patients, and that's a group called Patients Canada. Michael Decter is a former Deputy Minister of Health. He's the chair of Patients Canada. They made a presentation before the committee of the legislature pointing out that they're not on side with this. If this is truly the Patients First Act, why is the one group in Ontario, whose name is Patients Canada, opposed?
Well, they are one group, first of all. I was certainly surprised. The ministry was surprised when Michael made that presentation. He certainly didn't make me or my office aware that he had any concerns, and he obviously had sufficient time to do that as a result of the discussion paper being out there since December of last year. But I have to say that we have, through consultation with more than 6,000 individuals, I think we had about 200 meetings that were held throughout the province since December of last year, plus enormous feedback that we received electronically through emails and letters, that we consulted widely. In fact, we are continuing to consult, but we've consulted widely with Ontarians, with patients, with clinicians, with healthcare providers, and we're confident that what we've proposed, and which is now the legislation, the law in Ontario, reflects what Ontarians want to see in their healthcare system. When you look at the various components of it, we listened to public health in terms of what they felt that they could provide to the rest of the healthcare system. On primary care, we took the advice of the leadership in primary care themselves through the Price-Baker report and integrated that into the Patients First Act. We took the advice of RNAO, the Registered Nurses Association of Ontario, who said we should actually bring the home and community care workers closer to the front lines, delivering the services directly in conjunction with primary care and hospital care and elsewhere.
Well, you know what? I got 5 more people who've got more advice for you, and they're standing by to have their kick at you. So we thank you for coming into TVO tonight, Dr. Eric Hoskins, Minister of Health from Long-Term Care, and we'll see what the rest of the folks have to say about all this.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.